Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. I'm joined by Lanette Siragusa, Chief Nursing Officer for Shared Health. Today we're announcing 11 additional deaths due to COVID-19. This including a male in his 30s from the Winnipeg region, a female in her 40s from the Winnipeg region, a female in her 70s from the Winnipeg region linked to the outbreak at Health Science Centre at GA3, a female in her 80s from Prairie Mountain Health region linked to the Fairview Personal Care Home, a male in his 80s from Prairie Mountain Health also linked to the Fairview Personal Care Home, a male in his 80s from Southern Health Santé Sud linked to the outbreak at Villa Youville Personal Care Home, a male in his 80s from Winnipeg region linked to the outbreak at Charleswood Care Centre, a male in his 80s from Winnipeg region linked to the outbreak at Golden Links Lodge, a female in her 90s from Winnipeg region linked to the outbreak at St. Norbert Personal Care Home, a female in her 90s from the Winnipeg region, a male in his 90s from Southern Health Santé Sud linked to the Bridge Park Manor Assisted Living Facility. We extend our condolences to the family, friends, and loved ones. To these individuals we've announced today, as well as those over the weekend. So there's 11 more Manitobans that we've lost. I can still recall advising Manitobans of our first death related to COVID-19 back in March, and I remember that being a very somber day in Manitoba. And now we continue to announce many deaths every day. Today again into the double digits. I think we all know we can't continue along these lines. We have to bring these numbers down. We can't keep losing this many Manitobans. We know we have a burden on our healthcare system right now with all these numbers, so we really need to stay home and prevent the transmission of this virus. As of 9:30 a.m., 343 new cases of the virus have been identified, bringing our total number of lab-confirmed cases in Manitoba to 16,825. Current 5-day test positivity rate is 13.4% provincially, 13.7% in Winnipeg. Last week we announced that Manitoba was introducing additional steps to ensure improved case and contact investigations. We've implemented the outbound automated calling system. This expands on the current methods for case and contact monitoring. If a case or contact has a question, they can simply push a key and request a call back from public health. If a case or contact's at the end of the monitoring period and has no further questions, then that case or contact can be listed as closed. When the second phase is implemented, the system will be used to contact cases and the related contacts. This will allow us to be more responsive and reach more people sooner. Individuals will continue to receive personal calls from provincial public health officials. However, these are combined with these automated calls. The monitoring process will be more efficient and effective. We're introducing this safely with guidance from our public health team. And this automated call will provide the quickest, most efficient way to get Manitobans information they need to make informed decisions from the proper public health direction. People asked important information about testing, self-isolation, and other public health guidelines in a question and answer format with answers provided via keypad. Although the public health officials will never ask for personal information otherwise, such as banking information, social insurance numbers, credit card numbers, passport numbers, or other non-health related identification data. Share this information with your local police department. It is suspicious. Other provinces were able to make progress in this important area through the use of an automated phone call system that provides citizens with information about testing, treatment, and next steps. We believe that a similar system will be a valuable tool here for our province. We're going to ask Manitobans for their patience and cooperation as we roll out the system, and we expect this to continue to improve over time. And the message which we've been giving over the last number of weeks is stay home. It's clear we need to bring these case numbers down. We need to bring down the number of Manitobans we're losing to this virus. We need to reduce the strain on our healthcare system. And that action we need to take right now is to stay home for the most part. Go out for only essential reasons. Send only one member out of your household for those essential items if possible. There are great local options right here for online shopping, curbside pickup, delivery. Buy local, buy online, buy over the phone. Use that curbside pickup option. We have to avoid gatherings outside of our household. That includes faith-based gatherings or any other type of gatherings right now outside of our households. Employers, we need you to continue to support your employees to work from home as much as possible. Support your employees to find ways to self-isolate when required, to be away from work if they're ill or required to self-isolate. So we know these restrictions are hard. I know we've heard from a number of Manitobans that they want these restrictions lifted. Again, it's not a matter of wanting these restrictions. I don't think anyone wants these restrictions in place. It's what the consequence is of lifting them. The consequence of lifting these restrictions right now is a much longer page of Manitobans that we lost to this virus. Overwhelming of our healthcare system, more strain on our healthcare workers. So although we all want the restrictions lessened, none of us should want the consequences of lifting those restrictions, and that's what will happen at this point. So although these restrictions are very difficult, and it's been a long haul, we need these in place right now. And so we ask all Manitobans to follow them, not look ways to get around them, and for the most part, to stay home. It's in our short term right now, we will get around this, but right now we need all Manitobans to step up. Our healthcare system is pushed to its capacity right now. Our healthcare workers are telling us that they're overwhelmed. We need to get these daily numbers down, and the best way to do that, the quickest way to do that, is to stay home. And so, again, thanks to everyone. I know how difficult these times are, but together we can get these numbers down and look for better days ahead. So thanks, and I'll pass it over to Lanette.
Thank you very much. Good afternoon, everyone. The high rate of COVID transmission in our province continues to place pressure on our healthcare system. We had 341 people in hospital this morning throughout the province due to COVID. And for perspective, that is more than triple our number of hospitalization numbers from only a month ago. Our ICUs have also seen substantial increase in activity. As of midnight, our critical care program was 145% above our normal baseline pre-COVID. There are now 105 patients who are admitted into critical care at this time. 105 beds are in use in critical care. 44 of those beds are occupied by COVID patients. 31 of 70 patients who are on ventilators this morning have COVID. Again, to provide perspective, the number of COVID patients in our ICU has increased by nearly 2.5 times in this past month. Most importantly, we lost 247 Manitobans due to COVID in this past month. Nearly 80% of all the COVID deaths in Manitoba occurred in November. These people are more than statistics. They are parents and grandparents and aunts and uncles and brothers and sisters and now a child. It's a heartbreaking loss for people, for their families and their friends to endure. And it's made harder because of the inability to gather together and comfort each other and grieve. It's also difficult for our staff, many of whom are putting aside their own fears to work long hours in stressful environments, providing care and increasingly consoling families who have lost a loved one. And through it all, the health system continues to adapt and evolve to the demands of this virus. We have postponed non-urgent and elective surgeries so that we can redeploy staff and open up more medicine beds and try always to stay one step ahead of this virus. But the bottom line is our health system is at risk of being overwhelmed if we can't reduce these daily case counts. Many of us, most of us, are doing what we need to do, limiting our contacts and following the recommendations and the COVID precautions. It's not easy. We are all tired and we've been dealing with this virus what feels like a long time now, and the holidays are just around the corner. But if all of us can commit to doing what needs to be done now, there will be an end in sight, and we will make a difference, and we will save lives. I wanted to provide an update on the status of our healthcare workers who have tested positive for COVID-19. In the past week, 27 healthcare workers have tested positive for COVID out of 1,647 tests. The 27 positive cases include 13 from the Winnipeg Regional Health Authority, 9 from Prairie Mountain Health, 5 from Southern Health Santé Sud, and 1 from Interlake Eastern. There were 0 staff tested positive from Northern Regional Health Authority. Broken down by profession, this past week's numbers include 6 nurses, 15 allied health or support workers, 6 yet to be identified. We also received a request last week to provide more information about paramedics. We thought that was a good suggestion, so we're going to do that on a go-forward basis. To date, 19 paramedics have tested positive for COVID-19 since the start of the pandemic. None tested positive in the past week. So these numbers include 12 from Winnipeg, 4 from Southern Health Santé Sud, 2 from Prairie Mountain Health, 1 from Interlake Eastern. Finally, work also is underway to address a backlog, and they have uncovered an additional 164 positive cases involving healthcare workers since the start of the pandemic. This would include travel-related, close contacts in the community or in the workforce, as well as unknown acquisition. So this brings the overall number since March to 743. To date, 32,079 tests have been given to healthcare workers and paramedics in Manitoba. We continue to do all that we can to make it easier for staff to get tested. So as a reminder, the RotoGene is available to provide rapid testing for staff. They will get their results in 4 to 6 hours, specifically at Health Sciences as well as St. Boniface Hospital. This also includes having a dedicated testing site now for first responders and healthcare workers at the Winnipeg Fire Paramedic Services Training Academy. They saw 158 people in their first 5 days of operations. And we also continue to provide appointment spaces for healthcare workers at our testing sites on Pembina Highway as well as St. Mary's Road. And that is it for me. We can open it up to questions.
Thank you. A reminder to our reporters on the line, you will have one preliminary and one follow-up question this afternoon. Up first, from the Winnipeg Sun, Scott.
Hello, good afternoon to you both. Question for Lanette. This is going to sound quite blunt, but how many more people in personal care homes have to die before the military will be called in to help?
Well, my understanding in talking with operations is that additional support has been provided to those personal care homes. There have been IV teams set in. The palliative care programs are helping out. The who else is going in? The Red Cross is in some of them, and they're looking at deploying more of them out there. We've also assigned a lead for the PCH operators, the individual facilities, to talk to them and look at what the lessons learned are and really hear what the challenges are at individual sites. As you know, we have over 120 personal care homes. So, Scott, we're not opposed to having the military come in. We also have the Red River course training healthcare attendants right now as I speak, and they will be out in the workforce starting next week, and that is provincial in nature. So we're not opposed to having the military come in. We've had those discussions. The question would be, do we have the resources within to support? And we are working towards that. We are trying. And there may be a need for the military. We'll have to determine where that need is and when we deploy them.
Thanks for that. 37 of the last 56 deaths can be attributed to PCHs across the province. That dates back till Thursday, I believe. OCN up in Opaskwayak Cree Nation, they brought in the military to deal with their outbreak. They came in November 19th. Outbreak was declared over 10 days later. It seems like it works. There's, I don't know, 70% or 80% of PCHs in Winnipeg alone that have outbreaks. I guess, you say that there's, you don't oppose it, but I don't understand why, when it works so well, why not just do it?
Yeah, well, we're working with the regions to talk about what they need. They are looking internally at resources they can deploy. We will continue that conversation, and if we feel we need to deploy extra resources, we absolutely will do that. I just think that they're working from within right now, and although it does look like there is a lot of outbreak happening, there's many sites. Sometimes that is a PCH with one case. It might be a staff person. So it's a matter too of doing the testing, the cohorting, the cleaning. There's lots of things that we can do to prevent and contain what's happening in the PCH. And I think we've learned some lessons and we're getting better, and we all have to support, and we have to look at innovative ways to move people power, the resources to support those residents and the staff working there.
From CBC Radio Canada, Emily.
Good afternoon. Some colleagues from CBC shared the story of a Manitoba nurse who has COVID-19 and who is concerned that expired personal protective equipment she was issued may have put her at risk for contracting the virus. And she said she was caring for a COVID-19 positive patient and had been wearing what she later learned were expired masks. And they were apparently purchased 10 years ago for the H1N1 pandemic. Just could you share what are your thoughts on this, and is that concerning to you?
My understanding with those masks is that they were purchased during H1N1. That is accurate. They were checked by our infection prevention and control and occupational health teams before they were used, and they were deemed appropriate. They have recently been recalled because of the dates, the expiration of the dates, in an abundance of caution. So I think that I understand the concerns. The PPE is always being reassessed. There's things that we can do to make sure that we are as safe as possible, but that is a concern, and we're always trying to prevent in different ways. The PPE, the distancing, the cleaning, the screening are all parts of what we do to minimize the spread of COVID.
Thank you. And for example, in that case, does that mean that you're going to do, that some extra precaution are going to be taken next, or what are you thinking about this?
Sorry, what was the question? Exclusions?
No, sorry, extra precautions regarding
Extra
what happened.
precautions. Yeah, with the community spread that we're seeing now, we are looking at how can we serve patients who, when it's so, we can't always see who has COVID. So the testing and the precautions for people who you're not sure what the situation is, we are looking at what precautions need to be in place, what changes maybe we should be making to make sure that our staff is protected.
From CBC Manitoba, Bart.
Hi there, Dr. Roussin. Do you mind, can you explain specifically what is not allowed about the drive-in church services? How are they against the public health rules specifically?
Yeah, and so right now it's we've had sections before in our public health measures that specifically allow that exclude them from the group size limitations. In this one, the circuit breaker, where we really needed the messaging to be clear, that we wanted people to stay home as much as possible, that exemption was removed. So we're still dealing with a large amount of people, which would be against the group sizes. And so it's something that we continue to look at, but we know there's a lot of things that are very important to people. But we've heard from our healthcare providers, we can see the numbers, so we're asking Manitobans for, a relatively short period of time to take these steps, to stay home, to limit any type of gatherings because of how important it is. And as we move forward, we'll look again at whether we can accommodate those type of things.
Forgive me, though, that really isn't my question, though. If they're inside their cars, how does that violate the group size? If they're from a single household and they're inside their cars?
Yeah, if it's a large gathering inside one place, it still would be considered a large gathering. Like I said, we've had explicit exclusions for this in the past because we always considered that to be an issue with group sizes. So if you look at the past orders, we explicitly exempted these type of gatherings as being considered that. Whenever you're gathering a large amount of people in the same area for a prolonged period of time, then you look at other parts. Are people going to be in their car? Is that all household people in there? Does anyone need to use the washroom during this time? So there are risks involved, with it. So for the very short period of time, for Manitobans, for healthcare providers, for a healthcare system, we were asking Manitobans, let's just really do what we can just to stay home. And then, as we move forward, we can look at further type of exemptions.
From the Canadian Press, Steve.
Dr. Roussin, I know you're limited in what you can say in terms of personal health information, but we're looking for some more detail on the announcement on the weekend of the child under 10 years old who died. Can you tell us anything in terms of pre-existing conditions or any other factors that might have played a role?
Yeah, and so, absolutely, a tragic day here in Manitoba. I think, every day when we announce these is a tragedy to Manitobans and definitely to their loved ones. And And when we announce that, a death of such a youngster, that's really comes, really highlighted. So really all I could say is, there were underlying conditions that are relevant to that. But again, just like with all of our other cases, that doesn't diminish the loss.
And we're now more than 2 weeks into the province-wide code red. The number of daily cases is not accelerating higher. It's sort of stabilized roughly, but it hasn't dropped, and the test positivity rate hasn't really dropped either. So why do you think more than 2 weeks into code red, why do you think these numbers are not dropping, and what needs to happen to make them drop?
Well, I mean, it's clear the answer to what needs to happen is we need to decrease the number of contacts we have, and that's just a given. If we reduce the amount of contacts we have, those numbers have no choice but to drop. Right? We have a fairly consistent secondary attack rate, about 14%, meaning about 14% of contacts will develop COVID. And so if we decrease the amount of total contacts, we're going to decrease the amount of cases. There's just no way around that. And so numbers not coming down, and we continue to have the same secondary attack rate, just tells us that we're not reducing the number of contacts we have as effectively as we are shooting for. So we're 2 weeks in. You're right. We haven't seen that escalation. We had models putting us near 1,000 cases a day right now without any intervention. So it's certainly having an effect. But we do need to continue to bring those contact numbers down.
From CTV Winnipeg, Michelle.
How many contact tracers do we have total available to Manitoba? And how will the outbound calling system help them contact people in a timely manner?
Yeah, so in total, we have roughly for case investigations about 160, 170 people doing the case investigations, the contacting of cases, trying to find out who their contacts were. We then have another 86 or so Statistics Canada doing the contact notifications. We have a little over 50 doing active monitoring on here. So the goal of this is just to take a few steps away from each of those levels. So closing out cases, so contacting people on the last day of their isolation, going through the questionnaire and then closing that case just takes some of that work off those people. So right now we're reaching a significant amount of people within 24 hours, even more significant within 48 hours, and we just tend to improve that. And so the more we take of the more simple work off of these people, the more they can focus on the more complex work.
And just to follow up on the church question, is the concern that when everybody comes together in a vehicle and we're all in the same parking lot, that somebody's going to come out and you're going, the temptation is there to, get out and talk with somebody, because you could as easily watch or listen to a radio broadcast at home?
Well, we wanted to try to do that. Our recommendation is more virtual right now in the short term. And I think it's not necessarily specific to those events. It's just any type of event. The more people you have coming together at the same time, the more likely you're going to have some sort of gathering, some sort of transmission go on there. So, for the circuit breaker, where we wanted a real, significant change in the amount of contacts, we just didn't want large groups of people coming together.
From City News, Jonas.
Good afternoon, folks. Ms. Siragusa, first question for you. I just want to follow back up on the military and long-term care homes. How, the staffing levels right now, I know you mentioned outbreaks can be defined by one case. But from your conversations with regional leaders, in this redirection of staffing, is it working? I mean, what are they telling you about levels?
Well, part of the problem or the challenge, I would say, in OCN is that it was harder to redeploy people in the north than it would be in Winnipeg. Winnipeg has a lot more resources available to be redeployed. Well, it's not the ideal situation, it is the reality. So when we look at, in my conversations with the regional health authorities, the long-term care programs, absolutely it's a learning process, this redeployment, this working as in different teams, the timing of the testing, the timing of the cohorting, identifying people when they're positive. So all that, and the contact tracing too, all that comes into play. In terms of the staffing for the PCHs, there's about 5 or 6 PCHs in Winnipeg specifically that will struggle with staffing, and the struggle is most apparent evenings, nights, and weekends. So, and we also know that and we learned this from the first couple of PCH outbreaks, is that the residents do okay for the first few days, but we need to anticipate in advance that as the virus, the prognosis as it happens will increase the acuity needs. So that's why we've been able to send IV teams, palliative care teams, paramedics if we need to, short term if things are getting increasingly challenging at the sites, as well as the Red Cross and now the HCAs. So, and it'll be peaks and valleys with the outbreak as we go. So we have to support those PCHs, absolutely. I know they meet daily with the region, as well as now we're adding this extra layer of support for the operators. And we want to help them be successful, and we will move our people around. In terms of is it successful, I think it is a learning process. And there's people that are supporting from the hospitals, from the home care, as well as additional hires. So it's a work in progress is what I would say. It's not a perfect situation. The whole pandemic is not anything that we wanted, but we're learning to work with it, and we learn more every single day, and we are able to anticipate those needs. So that's my answer.
Ms. Siragusa. Dr. Roussin, just to follow up with you on some of the modeling, we're seeing, you had mentioned earlier that prior to Code Red coming in, we could have seen around 1,000 cases. What we're seeing now, was that modeling, I guess, is it pause? I guess, how would you describe what your models show now based on what our numbers are showing?
Yeah, and so we're still, the modeling, the calculations, remember, we don't just do sort of, mathematic or extrapolated modeling, right? We do agent-based modeling, so these are require thousands upon thousands of calculations, so they're being run right now to update our modeling, so I don't have any updates based on the last couple weeks of numbers. But yeah, when we were first looking at going into red, we were seeing that things were growing at a rate, sort of that worst case scenario with no public health interventions and no adherence to public health messaging. And so early December, we were modeling of over 1,000 cases per day. So seeing where we are right now, this is a reflection of the restrictions we have in place. I think it's clear that these aren't the numbers that we can continue to have. We still need to see these go down, though.
From CHVN, Taylor.
Hey, good afternoon. I believe both my questions are for you, Dr. Roussin. What is the risk of transmission from people inside of one car to another?
Just simply put that way, very, very low. But that's just one factor, right? If this is referring to a gathering like we had any large gatherings of cars. Now you're dealing with hundreds upon hundreds of cars gathered for an hour or more. If everyone stayed in their car and everyone was in the same household that was in their car, that would be a low risk. But I think gathering hundreds and hundreds of people right now for an hour or more has risk that that's not going to occur. So we're talking about in the short term here. We have a circuit breaker in place. Our hospitals are overwhelmed. Our healthcare providers are telling us that they're overwhelmed. We're asking Manitobans for a few weeks to try to limit gathering, do things in alternate ways right now because we're overwhelmed in the healthcare system.
And in the warmer months, churches very successfully did drive-in services. Before issuing the current public health orders, did the province reach out to any of them?
For these ones here, no. This is a circuit breaker for the second wave that we can't compare to what we saw during the first wave that you mentioned. So we needed to make big changes to bring these numbers down. We managed to stop that exponential growth we were seeing, but even at the numbers we're seeing right now, our hospitals are overwhelmed. And so we're asking Manitobans to, we certainly realize how difficult it is, not just this example, there's many examples about how difficult this is, and every Manitoban probably has a list of ways this has negatively impacted them. And pandemics are difficult times. And so we have to try to find ways to get through this without overwhelming our healthcare system, without losing so many Manitobans. And so even though it's very difficult, we've had to move this way.
From the Winnipeg Free Press, Danielle.
Hi, good afternoon. Dr. Roussin, can you provide some clarity around the age of the boy who died from COVID over the weekend? Can you tell the public if they were a school-age child?
So what I can tell you is that this case was not acquired in school.
And okay, so what message, I guess, do you have then for parents who hear this news and are scared about sending their child to class, knowing perhaps that someone in their child's age range died from the virus?
Well, so I'd say that this case is not representative of transmission in schools. We haven't seen a lot of transmission in schools, despite there being a lot of cases detected in school-age children. And fortunately, we haven't seen significant number of severe outcomes in that age group. So this should be a message to Manitobans that we're not done with this virus, that we all need to step up. We all realize how challenging these restrictions are, but they're there to prevent these type of things. And if we loosen these restrictions, if we keep finding ways around the orders, we're going to have increasing demands on our healthcare system. We're going to increase the length of that list I'm reading every day now of lost Manitobans. So we just really need to focus on staying home, leaving for those essential reasons, and bringing these numbers down.
From Global, Brittany.
Good afternoon, Dr. Roussin. I know we've talked to you a lot about vaccines the past few weeks. Federal government now has said it's going to be up to each province to determine who gets the vaccine first. Our province, is there some sort of committee, or how is it going to be decided what order people get vaccinated and when they have that vaccine available?
Yeah, so we have a vaccine task force right now, and public health is heavily involved in. And we meet regularly with provincial, territorial, and federal counterparts to look at that list. So it's very likely that the priority groups are going to be similar, or essentially the groups are going to be the same nationwide. There might be small differences between regions, but for the most part, we really hope that we could land on something nationally that will provide very similar, very aligned priority groups.
And can you give us an idea of who's on that task force? What kind of people?
Yeah, so public health certainly is the major roles on that, and then just other other levels throughout government on say things like for the logistics and the procurement aspects of it. So multiple levels of or multiple agencies in government, and as well as public health.
From the Brandon Sun, Michelle.
Good afternoon. Would it be possible to get a full update on the situation at Fairview Personal Care Home in Brandon, aside from the deaths announced today? I've received information that might indicate there are pre-existing issues at Fairview, and I don't mean pre-existing health conditions. I mean the level of care prior to the pandemic, and how that might be affecting our care home elders in this new context. Are you hearing anything of this nature? Can you speak to this?
I have not. Have you heard anything about Fairview?
Heard any of those issues?
No, sorry, Michelle. I don't have detail on that.
Okay, thank you. Second question then. There are two schools in the Brandon School Division that announced over the weekend there are cases of COVID-19, Vincent Massey High School and J.R. Reed School. Now, interestingly, the letter related to J.R. Reed School does not contain the usual line, the infection was not believed to be acquired at school. Considering the reports and studies recently that highlight young people are, for lack of a better word, super spreaders, can you provide some guidance and information for parents and anyone else who may be feeling increasingly worried about this potential transmission aspect of the pandemic? And have you considered testing more widely in schools?
Yeah, so I can't speak specifically to that, what you mentioned in that letter. I'm not sure if that's of significance or not. What I do know is we have a lot of cases in schools that are acquired in the community. We do a lot of contact investigation and a lot of testing of those contacts, and we just haven't seen a lot of transmission within schools. So we're certainly not seeing these super spreading events within schools. So obviously we continue to watch that very carefully. But schools right now are doing a great job at minimizing the transmission of this virus in those settings.
Thank you.
From CJOB, Will.
Good afternoon, everybody. First question for Ms. Siragusa. I believe you touched off the top on how many people are in ICU right now, but could you tell us how many beds are currently available and how are efforts going to expand the current capacity?
Yeah, so there's 105 patients right now in critical care. We have 110 beds in the system, so there's 5 beds available. This is as of this morning. Things change fairly quickly in critical care in the hospital. People can be transferred in or transferred out, but those were the latest numbers I have as of this morning. Also at Health Sciences Center, they are looking at potentially opening up another 14-bed unit if need be, that it's ready to go when the patients come, so that's there. As well as most of the ICUs are located close to the recovery room, so in the case of some sites like St. Boniface, potentially Brandon, if they need to expand capacity, it will be going into the recovery room spaces. They haven't yet, or they haven't at this time this morning, but that would be, if necessary, that's where they would flow to.
Okay, thank you for that. Second question for Dr. Roussin. We touched on vaccines a second ago. Could you tell us where exactly we are in the planning stages and maybe what are some of the biggest hurdles you're going to be coming up to now?
Yeah, and so we're well within the planning stages of starting to look at the priority groups, look at the exact numbers, and starting with the logistics of where the vaccine will be positioned and distributed. So some of the bigger issues, at least in the early aspects of this vaccine campaign, are those logistics. The early indications of these vaccines that will be first approved have a lot of logistical challenges with storage, stored at ultra low temperatures. And so require a lot of logistical work. So that's where a lot of the focus is right now.
From the Steinbach Carillon, Josh.
Hi there. Dr. Roussin, you've established that, I guess, a high test positivity rate indicate prominent community spread, but you also said on Friday that there's a good deal of testing capacity still in Steinbach. Can we conclude that people with COVID in the southeast are deciding to not get tested, or might there be another explanation for this?
Yeah, you can't conclude it based just on that, but that's the concern. When you have a test positivity rate up, 30, 40%, it's understood that under normal conditions you're going to be missing a lot of cases. I mean, we know that our test positive cases represent only a proportion of actual positive cases. We know that generally speaking, but as the test positivity rate goes up, we are, feel that there's many more cases that are missed. So we definitely want more testing done, want more case finding and more isolation done in those areas.
And just to be clear, it is normal if you have a high test positivity rate for your testing capacity to decrease in time, right?
To decrease the test positivity if you increase tests? Is that?
No. What I'm saying is that your testing capacity would decrease because you would have a high number of people with COVID who would go to get tested.
Well, we would think that the demands on the testing capacity would increase, yes.
Okay.
And from the Thompson Citizen, Ian.
Good afternoon, Dr. Roussin and Lanette Siragusa. How many cases of COVID-19 are associated with the outbreak at the acute care unit in the PA that was declared on the weekend?
Sure, if I have that. Sure. Do you have that form? No. Oh, I'm not sure if I have an update on that. Let me see. Yeah, I don't believe I have an update on that.
Okay. Given that the PA Hospital and Thompson are like the two hospitals in the north that, accept non-critical COVID positive patients, I mean, what does the outbreak have an effect on the capacity for treating patients of that type in the north?
Well, I mean, I think that whenever you have an outbreak in a facility, it puts increasing demands on it. There'll be extra measures being required on that ward. I don't know, I don't have an update if healthcare providers have been contacts or cases, and of course that puts some human resource demands on if people are off requiring to self-isolate. So there are increasing demands an outbreak poses on a facility.
Thank you, everyone. This concludes this afternoon's media briefing.